right, so first you need to like orient yourself a little bit with the heart. And right here at the top of the heart where the vessels are coming off, this is the base of the heart, okay? So the base or the top of the heart is where the vessels come off. And then where it goes to a point, this is the apex or the bottom of the heart. So it would sit in your chest like this, okay? All right? So now you need to be able to tell front from back. Here, this is the anterior or the front of the heart, and you know that. First you can see this, it kind of looks like a little flap, right, or a little wing on the front. This is the auricle. And then also this vessel right here. It's the only vessel that kind of goes across the heart and doesn't like come directly off the top. This is the pulmonary trunk, which you'll learn in a little bit. If you see the pulmonary trunk, it's the anterior or the front. If you don't see the pulmonary trunk, then it's the back or the posterior. Hey guys, they're trying to videotape and they can't hear. Okay, thanks. Okay, so if you don't see a pulmonary trunk, then it's the back or the posterior, okay? Y'all can still talk, just don't be loud. Okay, all right, so now you know anterior from posterior, you know base from apex. The atria are gonna be up near the base. The ventricles, think V, it's gonna be where the apex is, okay? So atria near the base, ventricles near the apex, okay? So let's open it. I like this side better. Oh, a few things. I forgot. Okay, so we're looking at the posterior. Does everyone see this kind of flap that's been cut away? Okay, this is this pericardial sac. It once encapsulated the entire heart, but we had to cut it away so you could actually see the heart. So this is the pericardial sac, tough connective tissue that surrounded the heart for protection, okay? So pericardial sac. If you just touch the heart, the outside of the heart, you're touching the epicardium, which is the connective tissue covering that's directly adhered to the outside of the heart for protection. So when you open the heart and you see, can you see it okay? Okay, and you see all of this kind of like tough tissue surrounding the cavities, this is all myocardium. Myo meaning muscle, okay? So this is all myocardium. The smooth tissue that's lining the cavities, that's endocardium. Endocardium is continuous with the endothelium of your blood vessels, so you can imagine why it's so important that it's so smooth. This is where the blood is actually going to touch and pool, and we want the blood to be able to flow through the heart with no friction or any sort of restriction, so we want it really smooth, okay? All right. Okay. Let's start off with blood that has just been oxygenated at the lungs, okay? So we have freshly oxygenated blood, and we need to go from the lungs to the heart so that the heart can pump it to the rest of the body, okay? Oxygenated blood from the lungs is going to come to the heart through pulmonary veins, right? You don't need to identify the pulmonary veins because they've been cut away, but that blood is going to pool into the left atria, okay? The atria will contract. It's going to push the blood down through the bicuspid or the mitral valve. Okay, so these are the flaps of the bicuspid or the mitral valve. They're anchored to the myocardium and also the ventricular walls through chordae tendineae. Chordae tendineae, these are what anchors the flaps, okay, of the valves. And where they're anchored at is called a papillary muscle, okay? So why would we need to anchor the flaps of our valves down? So that we don't get any sort of backflow. We don't want those valves to prolapse. Prolapse means go back up into the atria. We want a unidirectional flow of blood. So we want it to only go from atria to ventricles and not go back. Okay, so we want a one-way flow. So this is the mitral or the bicuspid valve, chordae tendineae, papillary muscles where it's anchored. Okay, atria contract. Oxygenated blood goes through the bicuspid or the mitral valve into the left ventricle. The ventricles contract. The blood is going to go up and out through the aortic semilunar valve. You don't need to identify your aortic semilunar valve on this heart, but on the models, yes, and then you do need to know it, but you don't need to identify it on this heart. So from the left ventricle through the aortic semilunar valve, through the aorta, so this big kind of central vessel coming off the top, this is the aorta. From the aorta through arteries, arterioles, capillary beds, we'll have gas and nutrient exchange. and then the deoxygenated blood will have to get back to the heart because it needs to be pumped back to the lungs to get reoxygenated. It's going to travel through venules, then veins, and we need to, so in order to see the vena cava, we have to look at the posterior part of the heart, the back. If it's deoxygenated blood coming back to the heart from below the heart, it's going to enter in through the inferior vena cava. If it's deoxygenated blood coming from above the heart back to the heart, it's going to enter through the superior vena cava. And I know these are the vena cava, my fingers are touching, okay? The heart itself also needs blood because it's made up of tissues, and tissues are made up of cells, and they need oxygen and nutrients. So that's what the coronary circulation is. If it's deoxygenated blood from the heart, from the blood that supplied the heart, it's going to, see where I'm kind of pumping right here? This gray area, this is the coronary sinus, okay? So, inferior because it's a little bit below, superior because it's a little bit above. From below the heart, inferior, above the heart, superior. From the actual heart itself, coronary sinus. All of that deoxygenated blood is going to pool into the right atrium. It's very small near the top. And it's actually kind of, if it's above the flap, it's the atria. Below the flap, it's the ventricle. The right atria will contract. Blood will go through the tricuspid valve into the right ventricle. The ventricles will contract. Blood will go up and out through the pulmonary semilunar valve, through the pulmonary trunk. This is the pulmonary trunk off the front, the anterior part of the heart. It's the only, like I said, it's the only vessel that kind of goes across the heart and not like directly off of it. This is the pulmonary trunk. From the pulmonary trunk to the lungs, oxygen will be taken up, CO2 released, and then it will come back to the heart through pulmonary veins back to the left atria, okay? And we've just made full circle. Keep in mind, this doesn't happen, like left side doesn't work separately from the right side, and then coronary circulation is something totally, it happens all at once. It's all simultaneous, but when you learn it for the first time, it's easier to separate left side from right side, but it's all happening at the same time.